Good
Hi there,
afternoon, everyone.
welcome. Sorry, go ahead.
Your grand Faisal, thank you. Good afternoon, everyone. And we're very excited to get started. I'm Amy Casey, and I'm the Endo-ERN Communication Manager. And I want to welcome you all to the first in a series of Getting to Know Endo-ERN. The purpose of these webinars is to inform not only our members, but the wider rare endocrine community about the various resources, supports, and supports that exist to help with research, virtual consultations, education and training, and of course, the reason that we're here today, registries. I'm delighted to be joined by our colleagues from the registry team, and I'll be introducing them briefly just in a moment. First, I want to start with some housekeeping. This webinar is being recorded and will be made available on the Endo-ERN YouTube channel if you'd like to share it with your colleagues. We will take questions at the end of the presentations, and you'll be able to raise your hand and we'll call on you. But if you prefer, you can put your questions into the question box that you should see on your control panel. And actually, if you don't see it, look out for a small box that says, helpfully, questions. So I'd like to make a very brief introduction of my colleagues. First of all, you've already heard from him today, Professor Faisal Ahmed, who's long been involved in disease registries and brings this vast experience to leading the registry team. Professor Ahmed's current research focuses on improving the care of people with rare endocrine conditions by developing interdisciplinary and international partnerships that facilitate research with a clear impact on healthcare. Professor Ahmed has appointments at the endocrinology department in Leiden, here in the Netherlands, as well as the Developmental Endocrinology Research Group based at the University of Glasgow Royal Hospital for Children. Also joining us this afternoon is Dr. Ana Luisa Priego Zurita. She's a pediatric endocrinologist and a Eurobone and EuRRECa Fellow, also based at the Leiden University Medical Center. And Tess DeRoy, she's the project assistant in the coordinating office for EuRRECa Eurobone. A recent addition to the team, Tess is providing organizational and quality support to the registry team. Thank you all for making yourselves available to present today, and I'll hand it over to you, Professor Ahmed.
Thank you, Amy, for that kind introduction, and thanks to Tess and Anna for joining me today, so we can talk about where we are with Rare Disease Registries, especially as they apply to Endo-ERN. I was so desperate to get on with it that I tried to preempt Amy there. But let me just start with my slides now. So what we're going to do is we've broken this into a kind of a, I'm going to start with the background, then Anna's going to talk about what's happening with the registry just now, and then Tess will give you some ideas of how you can find out more about the registries and how the project is going on. And then I'll bring it back to where we think we're heading. And then I think there will be enough time for some questions and answers as well. So we'll do it that way. Okay, so let's move on. So if I can see if I can actually get my slides to work. Oops, once more. Okay, there we go. Right, so what I'm going to do in this is I'm going to give you a little idea of why people use registries, why we want to use registries, why do ERNs need registries, what are the existing hurdles. I think you will know some of this yourself, but I'd like to just go over that, and then just go into more detail with the EuRRECa project and how it's evolving, and how the structure of EuRRECa Eurobone interlink with the ERNs, but also the professional societies such as SP, CTS, and ESE. So why use registries? Well, I guess the bottom line or the upper line is the fact that they allow collection of standardized clinical information on rare conditions, and that's the reason why people do that. But if you look at it, if I go around and ask a group of professionals as to healthcare providers, why do you think registries are important? And this is the kind of work we've done in the past through cost actions. People say, well, actually, it's for understanding pathogenesis or improving diagnostic yield, understanding the outcome, looking at quality of care, understanding the epidemiology. And it may also benefit regulators and industry. Those are the kinds of common things which people think about. If I ask patients, then they would say there are some additional reasons why they want registries, and this is partly because this may be a tool for patients and clinicians, a kind of a clinical tool where people can look at what information is being collected on them, and they can then use it to provide more information, enrich the information which may be there, such as through patient-reported outcomes and those kinds of tools. It also allows, a registry may also allow the patient voice to be heard by service planners. Okay, so because if there are more patients putting data in, then service planners will actually see that this is actually genuine data. They think that these registries may allow specialist centers to become more visible, and that it's not just the patients, which is interesting, that is the patient group who raised this, but also clinicians would say that too, and would agree with that. And lastly, it allows the conditions to be more visible. So if you know that there are 20 patients with a certain condition, then it's useful to know that that is the case. It may be a very rare condition, and people may think there's only one patient with that condition. So it's useful to have some exact numbers for that. I think one of the most important, greatest benefits of these registries is that they sort of allow collaboration to happen between centers through a network of centers. And then there's also this thing that if you have a network, a registry is very useful in the sense it shows that a network is working, there's activity going on in a network. And similarly, a registry cannot work without a network. So a registry has to have a scope, a geographical scope, or a scope which is a discipline-based scope, or whatever you want to think about as a scope. And that scope comes from a network. Okay, so the two things are very, very symbiotic. Okay. Why do ERNs need registries? And to me, an ERN is a network. You may consider it a reference network, or a network of reference centers, or whatever. But to me, it is a network of people. Okay, and again, within this, it's not just people, but it's a group of conditions. Okay, and we're talking about, let's say, from rare endocrine conditions as far as Endo-ERN goes. And there are two specific core indicators which the EU told us about a number of years ago when the ERNs were being created, and this may evolve over time, but one was this business that they wanted to, the ERNs had this core indicator which was to do with understanding a number of patients being referred or a number of procedures being performed. And this was linked to improving access to clinical advice, diagnosis, treatment, follow-up of patients. Okay, now that objective 2 is huge. Okay, 2.1 is just giving you an idea that there is one particular bit within this which can be measured. Okay, and then objective 8 is even huger. Or I don't think there's a word called huger, but it's even bigger than that. Okay, which is to do with understanding what the complex and long-term indicators may be for understanding patient satisfaction. Okay, or measuring that. Now, you can see that that was more specific ideas of that weren't provided then. And I think this is partly to do with the fact that the first one is measuring quantity and the second one is measuring quality. Okay, so quantity of care is, relatively speaking, easier to measure, and quality of care is a lot more difficult to measure. And there's still a lot of discussion going on. And this will follow into my next talk, which I'll be giving later. Now, what are the hurdles for using registries? Well, again, when we were setting this project up, when we were setting EuRRECa up, and this is in the early days of Endo-ERN, what we did, or what Selma, who was working with us at the time, what she did was that we did a survey of the centers who were initially coming into Endo-ERN, and we asked the center leads about their awareness of registries. Okay. And at the same time, and these are endocrine registries, and what we realized was that maybe about 75% of conditions which Endo-ERN was covering were already in there. Okay, were already covered by some registry led from Europe. We also looked at the directory of registries such as RD Connect and Orphanet, and we realized that there were a number of registries which we as endocrinologists knew about, but these directories didn't know about. Okay, so there's a lack of awareness on lots of different angles as far as the registries go. Okay, And not only these directories don't know about them, but we also know that there are a number of clinicians who don't know about these registries which exist in Europe. So one of the purposes of this particular project was that we wanted to raise awareness of registries. Okay, and this just over here just tells you about registries. The yellow ones are local registries, the gray ones are registries which are held nationally, and the blue ones are the ones which are held internationally for one group of conditions, which is sex chromosome, which are DSD, and this is the awareness levels and participation levels. So what we find is that even when people are aware of registries, if you look at any one of these, then you'll see the participation in registries is much lower than the awareness levels. So there are a number of different things which are going on over here, but awareness and participation is an issue. Why was this happening? Well, of course, people may not be aware of registries, but even when they are, they may not be sure about data sharing. They may not be sure about the suitability of this registry for them, or they don't know whether if they put these data into this registry, will this registry be sustained for a long time? Is it worth it putting data into a registry? And then some people think about patient focus, whether this registry has any particular patient focus. So you can see that there are a few different reasons for not taking part. Again, through cost action, we looked at this some time ago, and we know that although there are a number of people who use multi-center registries, there are quite a few people who do have an idea of registries, and they use registries locally. So they have a concept, and they do believe in the concept of registries. It's just that they have difficulty participating in multi-center registries. And I think the kinds of hurdles there are possibly not getting consent from parents or patients, not getting approvals locally, which is usually quite a small problem. Most centers tend to get approvals from their centers, from their local centers. So that's not the big issue. Lack of personnel and no time available, as you may imagine, are big things. And those are areas which we need to be thinking about when we are developing registries. I think in that area, probably one of the most critical people, and we don't think about that in an MDT, is a service coordinator, a database manager, those kinds of people. And more, nowadays, when I write a review or when I write anything or when I advise people about MDT clinics, I always say to them, please make sure that not only do you have 10 doctors in your team, 10 experts, but make sure that you also have a database manager or a service coordinator whose responsibility it is to make sure that the data are collected and put into registries. And these people are really worth the money in gold as we go forward, especially when we are talking about expert services for rare conditions. So the EuRRECa project, which was designed, was very much to maximize the opportunity for busy healthcare staff to participate in registry. We were aware of the fact that we're talking to people who are really busy in their jobs, okay? We wanted to provide a range of solutions depending on the needs and capacity of the users. We also wanted to cater to the needs of the ERNs, and you saw the needs of the ERNs in that previous slide. And we're looking at a low-cost platform, okay, which can do as much as possible. So a highly versatile product. We wanted to involve patients, and also we want to look at long-term sustainability through this platform, okay, because these are the kinds of things which we'd want to do. So what we developed, and we've been developing over the last few years, has been this project, and this is the nuts and bolts of it. So we developed this thing which is called EuRRECa over here, and we developed a Core Registry. The EuRRECa is a platform, it's a registry which allows you to enter data. You don't need consent for it because we don't collect any identifiers at all, okay? And we're just looking for new encounters, okay? So this is the first encounter. And the Core Registry is there for any encounter. It requires consent because we collect identifiers, okay? And in addition to that, we also want to collect detailed outcomes in that for specific groups of conditions where a registry doesn't exist already. For some things, there are existing detailed disease registries already. So we don't want to recreate things which are already happening. We want to signpost people to those registries. But for conditions where there are no registries, the Core Registry was the way to actually develop that, okay? And of course, these data will be provided to researchers through a data access committee. So this is the concept of EuRRECa. So EuRRECa is not just about one registry, but it's about multiple registries. Right, so let's keep going. Now this is how the project has evolved over time. So 2016 is when the ERNs were created. Okay, so Endo-ERN was approved then. Then in 2017, EuRRECa came about. Okay, we developed the ERREC platform first, that's the registry, and then in 2019, the Core Registry was developed. Now in 2020, we went into what I call phase 1B. Okay, so phase 1B was that when B for bone, okay, as well as B, of course. What happened was that we joined forces with EuRRECa, which is the registry which was which was developed to help ERN bond. And then gradually we've moved further on. So in 2022, our funding our initial funding finished, and the registries moved from Glasgow, where I'm right now, to Leiden, where Tess and Anna are. And then we've then started to think of how we're going to go forward. And this is where I'm looking at phase 3, and this is where things will move after our current bridging grant, which is supported by Endo-ERN and ERN bond. So you can see the different phases, and that's how we're developing. And at the top are the funders, so really very much funded by the European Health Programme, but also the societies SB and ESC in our phase 1A, and we would like that to continue in the long term. Right, this is just quickly just touching on what the structure looks like. So very much we have a steering committee and data access committee, and that has the societies and the ERNs working with us. And then we have a project management group, which is based in LUMC. How it happens with Endo-ERN very much is that we sit over here in this yellow box over here, which is under other digital activities, which is a bit vague, I have to say, but it doesn't matter. That's where the registries are. These are the people who are advising us, but you can see how we are a cross-cutting theme across all the different MTGs, because registries would apply to all MTGs and trying to quantify the activity as well as the outcomes in that. Okay, so with that, I will move this on to Anna. We're going to take questions at the end, but of course, if you have any burning questions, then please just put that into the box, which Amy was mentioning earlier on. So Anna, over to you.
Hi, thanks, Faisal. And thanks for the introduction. This will make it easier for people to understand the results I'll present. And Faisal told you already about who we are, what we're supposed to be doing. And now I will tell you about what we've been doing during these past years, and also a bit of practical things on how to participate in the registries. So I'll start by showing you a little bit about ERREC. And I chose to have this slide first because it shows what ERREC is when you are using ERREC. So after you are registered as a reporter, the first thing you will have to do to start reporting is to personalize a reporting setup. And here on the left, you'll see a screenshot of the ERREC platform, where you'll see a list of the MTGs, including also the bone dysplasia MTG. If you click on any of those MTGs, there will be a list displayed, as you can see in this example, with the MTG6 for hypothalamus and pituitary, and the list of conditions covered by that MTG will become available. Then what the reporter needs to do is choose the diagnosis he or she wants to report on and the group of age. And it is important to mention that here you see, for example, a question mark, and the box is a bit lighter. And this means that I cannot select this diagnosis because someone else at my center is already reporting that diagnosis in that group of age. And that is to avoid double reporting. So after one personalizes the reporting setup, then the next step is to actually complete a monthly survey. And this is an example of the survey that you would complete with this reporting setup. So all you are asked to do is to fill in the number of cases, suspected and confirmed cases seen during that month. You can save the return or you can submit it. And once you submit it, you will get some ERREC IDs, one for each of the cases you reported. And we ask you to please keep a database at your center where you link the EURRECa ID with the actual case, because this is a completely anonymous process and we have no way of knowing to whom that EURRECa ID belongs. So this is the practical part of reporting EURREC. And moving on to some results, this map shows the centers that are reporting in EURREC. And from July 2018, when the platform started collecting data, until December 2022, 66 centers from 22 countries were reporting in EURREC. And we also like to show what's the affiliation of these centers to the ERNs. So we see that there were 27 centers that were Endo-ERN exclusively, 18 centers were both Endo-ERN and Bond, 4 centers were only Bond, but there were also 17 centers that were not affiliated to any of these ERNs. And Faisal also touched on this briefly during his introduction, and this is something we also like to highlight. This pie chart shows the distribution of cases according to main thematic groups, and we see that most cases are reported within the MTG6 for hypothalamus and pituitary, followed by the sex development and maturation group, thyroid, adrenal, and in lesser degree other MTGs. And yes, until December 2022, over 20,000 cases had been entered in EURREC. Here we see the trend of the centers that are participating, and the centers that are reporting each month, also in pediatric and adult. And the line in yellow shows the cumulative centers reporting on adults, and the orange line shows the cumulative numbers of centers reporting in children. So we see that until December we had 59 centers reporting on adults and 48 centers reporting on children. And here we also highlighted when EuRREBone started or joined also the platforms. Here we see the number of cases that have been reported in the EURREC platform, and we see in the yellow, sorry, there's no yellow here. In the blue columns, we see the pediatric cases, and the orange columns or bars show the adult cases. And we see very nicely how the number of cases per year increased until 2021. Last year, we saw these numbers drop a little bit. But yes, we also show this in the figures that I will show next. And these figures show a breakdown on the MTGs, in particular this one on the pediatric cases. And we see that for children, the MTG where most cases are reported is sex development and maturation. And if we look at the adult cases, we see that this group is the MTG6 for hypothalamus and pituitary. And I will show you a little bit more about this in the coming slides. So we have for each of the MTGs, we have a breakdown of the diagnoses that we cover in each of them. Of course, for time reasons, we won't show all of those, all of these figures, but we picked a couple just to show you and give you an idea of what we're collecting and what we're doing. And in the case of MTG2, here in the bottom, we see the diagnoses that are covered in this MTG and in the adults. For instance, hypoparathyroidism and hyperparathyroidism, including parathyroid cancer, are the most reported conditions, while in children, XLH, hypoparathyroidism, and pseudohypoparathyroidism are the most reported. MTG6 is the most active group in the adult group of age. We see that we have, yes, about 4,000 cases of pituitary adenoma, which is the most reported diagnosis in adults, followed by acquired hypopituitarism, while in children, diagnosis like congenital hypopituitarism is the most reported. Of course, we have a complete report on this data, and it's available on the website. So I invite you to go to the website and check these reports for more information. Now moving on to the Core Registry. The Core Registry, as Faisal explained, well, there's a difference between the platforms. Basically, the nature of the data that is collected in these platforms, it's different, and the functions or things that we can do, the flexibility is different. But mainly because of the difference in the type of data and the identifiers that are collected in the core registry, there are different steps, or there are more steps to get to participate in the platform. So we thought it was useful to give you an idea or a breakdown of these steps, and just tell you what we can also do for you, or what we have done for other centers who are interested in participating. And of course, the first thing is obtaining local approvals. You must go to the boards at your centers and ask for approvals, and for this you might need some documents. We have documents available at the website, such as ethics approvals. We have data sharing agreements. We have data management plans that your center might require in order to approve your participation. But please, if you cannot find something you need at our website, where we have most of the things you might need, do contact us, and we're happy to help. The next step is, of course, the informed consent, which is the first step to recruit a patient. And there are two types of consent, opt-in and opt-out. Most countries use the opt-in system, and this means that you need to consent the patient beforehand. So before you enter the data, you need to get the approval of the patient. And the opt-out consent means that you can enter the data, and unless the patient express that he or she would like the data retrieved from the database or registry, then you don't need to consent the patient before entering the data. For the opt-in, for centers using opt-in consent, we have translations that have been kindly provided by the centers that have gone through the process of getting approvals, translating the informed consent to their language. And we have a list of translations that are open, available at the website if you need to adapt something. And of course, the original English version. And we do ask to you, if you get a translation, please share it with us, because it might benefit other centers from the same country or using the same language. Then the next step is to recruit patients and provide access to them. Recruit patients, of course, talk to patients about the registry and identify those who might have an interest to participate, obtain their informed consent. And as part of the informed consent, we ask questions regarding the sharing of data, but also if they would like to have access to the platform, because patients can access the core registry and use it. And when patients would like access, then the invitation needs to come from the clinician. So please do provide access to patients willing to participate. And then the next step, of course, is adding the data to the registry. And I will go a little bit more into detail in this part in the coming slides, but there are in general 3 levels you can get involved with the core registry. And one is completing the common data elements. Then you can go further and complete generic patient-reported outcome measures. And the deepest level would be to complete condition-specific outcomes or modules. And last but not least, the data is there for a reason, is there to be used. So please consider applying for data. If you have a research question or you would like to do some research with the data we collect, you can go to the website and you can check out our conditions, dictionaries, data dictionaries, and you can get an idea of what we collect if you don't have access to the registries. And of course, this would go through a process with the data access committee, completing a request and getting approved, but do consider it. Moving on to some results. Oh, sorry. Before the results, just also a little bit of practical stuff on how to participate or enter data in the core registry. So as I said, the first step is to get the informed consent from the patient. And then we have the common data elements. The common data elements in the platform are divided into different sets. In other words, you'll see them in 2 different screens. The first data set for the common data elements collects some mandatory fields, such as the consent of the patient, the type of consent. We want to know that the patient consented and what kind of consent. We would like to know the date of birth, and very important, we would like to know the MTG, the condition of the patient falls under, because this will open different things in the registry or different lists of possible diagnoses. Then there are some other questions, and very important, in the bottom part of this first set, there's a list of questions that are directed at collecting the levels of consent from the patient. So we want to know if the patient would like to share data for research, if he or she can be contacted for research purposes, if they would like to be contacted for collecting patient-reported outcomes, and also if they would like to access the core registry. And then the second set of common data elements, as I said, this depends on the selection of the MTG, and you'll have different primary conditions and specific diagnosis to select from. So this is the first level, and I will show you some results, and I will finish with a little bit more of what these different levels are. Until December 2022, 21 centers from 13 countries were entering data in the core registry. Here in the map and in the legend, we see which countries and how many centers per country are actively putting cases in the core registry. And again, just to mention the affiliation to ERNs, 4 centers were Endo-ERN only, and 10 centers were both affiliated to Endo-ERN and ERN Bond. But there are also 7 centers that have no affiliation to any of these ERNs. The figure on the left shows the trend in the centers that register to use the core registry and the countries, and it also shows in the gray and yellow lines the active centers, so those centers that are putting records in the core registry, because we get registrations, but truth is that not every registered user is using the core registry. And on the right, we see also the trend of the cases that have been entered in the core registry since July 2019, when the platform became operational. And until December last year, we had 1,180 patients, unique IDs of patients entered in the core registry. Looking at the age distribution of these patients, we see that the median age is 31 years, with 19% of patients falling in the range of 0 to 9, 17% between the range of 10 to 17 years, and most patients, 63.7%, falling under the age of above 18, so adult, or a definition of adult patients. The pie chart on the right shows the distribution of patients according to the condition, the main thematic groups or condition groups. And we see that most patients, 32% of these patients, have been entered to the MTG6 or pituitary group, followed by the sex development and maturation group with 22%, and the bone dysplasia with 18% of cases. We see different degrees of, for the rest of the MTGs. And then moving on to the patient status, we see that 80% of the patients that are now in the core registry are patients that have an active follow-up, meaning that are patients that are still followed by the center that entered and the reported who entered the case. And we, interestingly, we see that there is a good number of patients which whose status is unknown, but this is part of our quality exercises, and of course these centers have been contacted to ask, please can you update this status. On the right, we see the participation of centers in detailed disease registries, and we see that about 30% of all the patients that are now in the core registry are also participating in another detailed disease registry. And we see that, for instance, in dark blue, the sex development and maturation group. If we compare this to the total number of patients in this group in the core registry, these 207 patients represent 80%. So 80% of the patients in the registry in the sex and development group also are participating in another registry. And this is followed by the bone dysplasia group, where 25% of the patients are also participating in another registry. And for the calcium and phosphate, we also have the 25% are participating in another disease registry. We find it interesting to look at the patient consent levels because, of course, one of our goals, and we have been working also on developing patient-reported outcomes, and it's interesting to look at these numbers and understand why the participation of patients or the recruitment is how it is. And these are the questions that I showed you in the first common data element set. And looking at the yes and no responses to these questions, we see that virtually all patients are happy to share their data for research purposes, and that they are also fine with being contacted for research purposes. But when it comes to getting more active in participating with the registry, this percentage or this wish starts to decrease. We see that a little bit less of 90% of patients are okay with being contacted for collecting patient-reported outcomes. And when we ask about whether they would like access to the core registry, this number drops to a little bit less than 50%. And well, for the newsletter, it's even a little bit less. And looking at if there are differences between or across all the MTGs in the patient wish to access the platform, we see that in some groups like MTG7 for sex development and for pituitary and for adrenal, over 50% of patients, and here in MTG7 almost 80, they are happy to have access to the platform. But we see other MTGs where this wish to participate is not so high. Well, as I mentioned before, the participation of the patient in the registry or the access comes from an invitation from the clinician. And it's also interesting to look at what's happening there, because one thing is that the patient expresses their wish to access the platform, but then he or she needs to receive an invitation. In general, these are the centers where patients have expressed their wish to access the platform. And of course, we see different, depending on the number of entries for each center, we see different numbers of patients who would like access. But I think in general, we are doing okay because most of the patients who would like access have received an invitation. In orange, we see the patients who have received this, and in blue, we see the patients who are still waiting for an invitation. Then moving on to the generic PROMs, we have some patient-reported outcome measures in the Core Registry platform, and we have different languages when it's possible. And this is just the activity in completing PROMs, and patients and also doctors can complete them. So here we just wanted to show what's the activity there, who is completing, and what they're completing. And EQ5D, which we have in different languages, it's the most completed questionnaire. It's also been there for a longer time, but we see that until now we have 57 outcomes completed by a doctor and 5 completed by a patient. For the ICF, the WHO ICF outcome, it's also mostly used by doctors. And the BPI short form, the brief pain inventory short form, which was more recently added. We also have some outcomes completed by doctors, and promises the less used. So yes, I will start wrapping up my talk, and in this slide, I come back to the levels of participation in the core registry that I mentioned at the beginning. And here on the left, I put clinician and patient because we know that this platform can be used by both. And here on the top, I included the different levels of participation. So the first level would be completing the common data elements. And this is more towards the clinician side because the clinician needs to recruit the patient, enter the common data elements. Of course, there's some involvement of the patient because they need to consent to participate. And then we move to generic outcomes, and this is sitting here in the middle or in the center. This is a summary of the PROMs that we have at the moment: EQ5D, the WHO ICF, some promise measures, the BPI short form, and the oral health 14 items questionnaire. And you can see some details about the languages or the number of languages that we have. And this can be completed either by the clinician or the patient. And when a clinician would like a specific questionnaire to be completed by the patient, he or she can set up frequency for request and which questionnaire. But yes, so this can be completed by either the clinician or the patient. And the deepest level of involvement would be the diagnosis specific outcome completion or the participation in the condition specific modules. And this is a list of the modules that we have at the moment. And my next and last slide gives you more information about these condition specific modules. On the left, we see when these modules were released or became available in the core registry. In dark blue, we see all the modules that are at the moment active and also how many outcomes have been completed for that module. And in light blue, the last module here, it's a module that is still in development but will be available in a couple of months. And on the right, we see who is leading that study group. Well, this is the deepest level of involvement in the core registry. And this is my last slide. I'm happy to take questions at the end. And Tess, the floor is yours.
Thank you, Anna. I'm waiting to get control to go to the next slide.
You should have control now, Tess.
Let me check.
There you go.
Okay, perfect. Well, thanks. Thank you, Amy. So after hearing all about the registries, the way we set it up and what you can do with it, it might be interesting to know where you can find more information in case you have more specific questions. So the first place to go would be our website. Anna already mentioned it. On the website, you can find our ERREC reports, you can find documentations that are needed to start with the core registry. You can find information for your patients and you can access the registries from the website. We are currently using the website EuRRECa.net, but in a few weeks we will launch our new website, which is EuRREP.eu. If this will be a combined website of EuRRECa and EuRBone, because we are sharing a project management team and we share a lot of the same documents, we decided to move to a new website with the two organizations combined. It's currently under construction and we will launch in a few weeks from now. So once that is happening, you will definitely hear from it, and hopefully you can visit our new website soon. But for now, you can go to EuRRECa.net. But we also have our drop-in sessions. This is a place this is something we do every second Friday and every fourth Wednesday. So the current time slot that we're having is originally a drop-in session. We will do this online via Zoom. You can go to the link in the bottom of the slide to find out more information, to find a Zoom link, and also a calendar on when those drop-in sessions are taking place. This is for everyone who wants to know more about the registries or has a very specific question, either technical or reporting issues, but also for patients who are interested in learning more about the registries or anything you'd like to know. You don't have to be a clinician, you don't have to be a reporter. We can also use this time to help you set up an account if you have trouble doing that. Then we also are present at conferences and events. The most two important events that are coming is our own symposium taking place on the 3rd of April. You can follow this online via live stream. This is not an interactive live stream, so you won't be able to ask questions, but you will be able to find a lot more about the registries through our symposium and through the presentations that will be taking place. We're also present at the Endo-ERN GA the 2 days after that, 4th and 5th of April. We'll be actually having onboarding consultations. This is only available for people already visiting the GA, so we'll be there in person. We will have 20 minutes in person one-on-one consultations to help you get started with the registries. So we can help you set up an account, we can help you find out documents you need, maybe some ethical issues that you're experiencing. We will have a booking page, so it will be the same as when you're booking an appointment with your hairdresser. You can find a date and a time slot, and then we will be available for you in the room that is also on the booking page. But if you already like to start using registries and if you're already curious how it looks like and want to try to start it yourself, these are some steps that you will have to follow when you want to register as a user. So we have a registration page. This is for both EuRRECa and the Core Registry. You can select either one or both of the buttons to become an EuRRECa reporter or a Core Registry clinical contributor. Yeah, you have to fill out all the information and then you can select your center from the list. If your center already exists, you can just click submit and then it's done. If your center is not yet in the list and you have to add a new center, you will select that your center is not listed, and then more questions will appear with information regarding the center. Confirm with your colleagues who will be the center lead. This is the person who will also be in charge of approving other registries, other users wanting to be part of that center lead. So check with your colleagues who wants to be the center lead, or if your center is already existing, who is the center lead if you don't know it. So yeah, that's a short summary of how to find out more. You can take it back over, Faisal, to close this webinar.
Thanks so much. Well, I hope you've got a good idea, everybody, about what the registry project EuRRECa and EuRRECa and its sister projects all about. So in the last couple of minutes, what I want to do is just focus on what we've learned and where we're going with this. So let's see if I've got the control back. I think I do. Yeah, so where are we, the challenges and the future directions. So I think what we've shown you is a portfolio of tools which EuRRECa offers at the moment. Okay, so you've got the e-reporting tool, which is the registry, the ERRECa registry, and then what Anna's shown you is the core data set, or what you call the core data elements, and then the clinician reported outcomes, which are through those modules which have been developed, and the patient reported outcomes, which are through either the generic outcomes or there could be some other outcomes, which could be more condition specific. So we are trying to maximize the opportunity for healthcare staff to participate in registries through all these different solutions. Okay, and I think we, as you can see, we're now catering for ERN bond as well as Endo-ERN. Okay, and we've got the involvement of patients. So the water is there. Okay, and we've got the horses on the other side. We just need to now get the horses in the water to match up and get them to each other. Okay, and I think by doing this and by becoming an integral part of the ERNs, we think we will be sustainable over the longer period. I think the challenges we face very much is the fact that at the moment, as you saw for Endo-ERN specifically, about 50% of centers are actually using EuRRECa. Okay, so we would like that to increase. But then I don't necessarily think we have to carry on waiting for 100% of the centers. I think there's a lot of data there already. And I think we need now, not only do we need people to put data in, but we need people to take data out. And we need people to be actually coming to us and saying, we want to do some research with the data we have. And the same thing applies to the core registry. Less centers, and understandably, because it requires a lot more work in the sense of getting consent and things. the less centers using it. But again, we want that to increase. But at the same time, we want people to use the data which is there already. Okay. And I think that will, quite a lot of that will happen through the study-specific modules, which we've been talking about, the condition-specific modules. So I think we need to focus a lot on that. We are covering a lot of conditions, okay, and it is highly likely that, well, definitely we won't be able to have condition-specific modules for everything. So we are going to start focusing on those condition-specific modules which are there already and try to support those people as much as possible. I do think we need to be thinking about data managers, and this is something which I would say to you as centers, healthcare providers, that please think about these people in your centers and how you can resource them. We will see whether from our end and from Endo-ERN, whether there is anything we can do to provide you with some support. But I think that will never be sufficient. It will a lot of that has to come from the centers themselves, who are expert or reference centers. Okay, and we need to, although we are focusing a lot on quantity, we do need to focus on quality as well. And really, as we go forward, I think we need to be thinking of quality care indicators and how this will, how these will develop. And I think this is where the registries come in for Endo-ERN and ERN-PON, because it's all about quality of care. But although I'm an endocrinologist, a pediatric endocrinologist, my area is very much DSD. I don't know what the critical quality of care indicators are in your specific area of endocrinology. And so this is where the stakeholders have to come in. They have to tell us what are these quality care indicators. So stakeholder involvement is going to be crucial for this. Okay, so if I go to my last slide, I just want to thank people over here who are involved in this EuRRECa YourBone project. And please have a look at our ERREC and Core Registry reports which are on the website. That will give you a lot more detail. Okay, so we've got a few minutes, Amy, for questions. I hope we haven't taken up too much time.
No, I think you're right on schedule. And thank you so much for such informative presentations. I'm just going to check the audience now and give them the ability to put up their hand and to unmute themselves. So if you have a question, you are actually able to unmute yourself, or you can put a hand up and I will unmute you. Just while we're waiting for people to ask questions, may I ask a question, Faisal, about the data managers? You mentioned that at the beginning and you mentioned it at the end. Is this a trend that is actually happening in healthcare, that data managers are becoming an integral part of the team? Can you speak to that at all? And I'm sorry, I see you're muted now.
Perfect. Thanks so much. Yeah, thanks for raising it again, Amy. And I'm glad you took that bait because it is an important area which I think we need to be thinking about. My own experiences across reference centers, that this is quite variable. There are some reference centers which are much more well-resourced than others when it comes to having that kind of support goes. And I think these people are becoming quite critical. Often the task of putting data into the registry gets given to one person. This may be quite a senior person who's got lots of other clinical responsibilities. So I think it can be done by that one person, but they need to have time within their plan and within their job to actually do that. So there are centers developing across many countries where these people are now shared between not just endocrinology, but with other specialties as well. So you may have a database manager who doesn't just do rare endocrine, but does rare bone and rare cancer and rare other sort of rare conditions. So you can imagine that especially a center which has many ERNs, could develop these kinds of common resources.
Thank you. That's really interesting. We have a question, actually, Dr. Mertens. I'll go ahead and unmute you.
Yeah, hello, good afternoon. Can you hear me?
Yes, we can hear you.
Yes, in fact, I have two questions, practical questions. I work in Leuven in Belgium, and for Endo-ERN, we have registration for the EuRRECa, but not yet for the Core Registry. What do I have exactly to do to also put data in the Core Registry?
Who wants to take this? Anna, do you want to take this? You just need to register, but I think Anna's having difficulty getting through. But if you've already registered, you should have an ERRECa account, and you will have a Core Registry account as well, because I think we use the same system, don't we? Is anybody else got a? Yeah.
Yeah, I was able to unmute, you know. But yes, so if you log into the ERRECa platform, if you go to the upper right corner, then you have some account settings, and you can update your roles, and you can choose the Core Registry clinical contributor role, and that's on the practical part, on the technical part. And then of course, I'm not sure. Yeah, you would need to check what the process would be with the ethics approval and all those documents. We have them on the website.
I think the simplest thing would be to come to our drop-in, and
Yes.
and we can navigate you through the whole thing and
Exactly.
take you through it. Yeah, or we'll see you in Amsterdam.
Yeah, I will be there.
You can book your appointment with us.
Yes, book your slot with Ted.
I will do, because I have some other practical questions, so I will do. Thank you.
Yeah.
And just while we wait for other questions to come through, Anna, may I ask you another question about, you say there's documentation and such available for the ethics approval process. Is it a matter of the members downloading this information, or do you help them during the drop-in? And do you have any feedback on how easy it is to get through ethics approval with documentation, or any caveats that you might like to include?
Yes, on the website for both the Core Registry and ERRECa, there's a different drop-down menu, and we have an ethics approval tab. If you click there, you'll find the documentation you might need for to get approval for either of the platforms. That documentation is there available for downloading, and some centers might need different things, so there's no one formula for everyone. Some centers have different requirements. Some of them, it's enough with what we have on the website, but some others approach us and ask, my center would like to adapt a little bit this information, or we need to provide a data sharing agreement. So that depends on each center. If they come to the drop-ins with an idea of what they might need, so it's maybe a good idea to start the process at their center and know a little bit about what extra requirements they might need. And yeah, they can join the drop-in or send us an email, and we are happy to help. But that's our experience. I would say most of the centers, the process is mostly the same, but there are some centers that have different requirements.
Okay, but the team are there to support them, which is great to hear. Actually,
yes,
it's a wonderful support. Okay, I think we are on the nose for 5 o'clock. I think the presentations were extremely informative, and that's perhaps why we haven't had a raft of questions. People know that they can come to a drop-in or check out the website and actually visit us in Amsterdam. So I just want to take a chance to thank you all for your presentations today, to thank the attendees on behalf of Endo-ERN for attending today. And we will continue to have a series of webinars getting to know Endo, and we have our usual clinical webinars as well. So look out for those in the bi-weekly newsletter. And with that, I will close the event, and thank you so very much. Have a nice evening.